Okay, we're on. So I want to talk to you about stress today, what really stress is. And before I go into stress, I want to talk about which I've already mentioned before, is that how I work in a non-specific way as a functional health coach. I'm not a doctor. I don't diagnose anything. We just find healing opportunities. We work in a non-specific way, love to build health, create balance, restore functions, by doing some detective work. And so that's what we do. We investigate into things, help you run labs, and then we compare and contrast them and find the hidden stressors and work towards them using our DRESS protocol, DRESS for health success, the diet, rest, exercise, stress reduction, and supplementation. And that's exactly what I'm going to talk about today. The kind of stress, the role of stress, what it does, and what we do with the stress to help to bring the load down. Okay, so having said that, I am going to share a screen. Let's see. Okay, so here we have a chart called physiological aspects of metabolic chaos. What this really is that it illustrates our holistic nature and how everything is interconnected. So unlike going to a conventional doctor where you have a different person, a different doctor specialized in a different body parts, rheumatology, nephrology, pulmonology, gastroenterology. Here we are all connected. Everything is interconnected. So this is why we call it taking a holistic approach. So the circle in the middle called metabolic chaos, that represents the command center. And all the other systems around it represent the different systems in the body. And they also represent different categories in the metabolic chaos scorecard. So when our body is under chronic stress, our body goes out of whack, leading to lots of symptoms and complaints. When this happens, we call our body being in metabolic chaos. This just means that body is not firing on all cylinders. So let's take a look at these different circles and see how any system can be compromised. Now, let's take a look at the endocrine system. The endocrine system, endocrine function, this area can be compromised if we are not able to handle stress well. Our thyroid can be compromised if we're not handling the stress well. All the hormones have a similar problem. Some things that I've had going in my life with not being able to have balance of hormones, mood issues. We can have all sorts of issues related to hormones, but we're not really noticing any significant amount of problem. All we see is low energy, no energy to exercise, just the smallest symptoms like that are attached, that are created by endocrine system, can be all compromised when we are under a lot of stress. Now let's look at the neural tissue health. Sometimes when we're trying to learn something new, we're not able to concentrate, we become forgetful, learning can become difficult, and all these can be influenced by not being able to manage stress well. Our quality of sleep can play a big role in this area. Um, I'm sure working night shift doesn't help. It's just we have this, definitely we have this decreased ability to handle stress when we have a high pressure job. Not being able to fulfill financially is a major stress. And when it's just something doesn't feel right, it just becomes frustrating. We can become absent-minded, irritable, have problems with insomnia, and so many things are connected to this neural tissue. Looking at musculoskeletal system, we can have joint issues, stiffness, pain, sprains, um, loss of muscle mass. Having strong bones are really important to us. We could also have connective tissue. Lifting weight can become a problem. Recovery and regenerating becomes really compromised when we're not managing stress well. Now, if we look over to the next part where it says carb metabolism, now when we are under a lot of stress, this becomes a big player in here. Sugar cravings can take over. All the physical cravings can take over, but not to be hard on yourself. We can figure out your proper macronutrient ratio to balance out the blood sugar and find underlying cause of the blood sugar dysregulation there. Looking at the icosanoid modulation, this is the inflammatory and immune dysregulation marker. Another area that can be compromised. Looking at inflammation in the body and its role, as well as its role in the immune system, can be all compromised with stress. We could sometimes we just see simple things like chronic fatigue. We could have Hashimoto's, autoimmune disease of thyroid, food intolerance, food allergies, inflammation, infection. These all play a huge role in immune system. Now looking at the detox capacity. Detox capacity, our next circle. It's our body's ability to manage toxic load, whether it's an internal stress or external stress being compromised. I mean, we can have nightmares, gas, bloating, diarrhea, alternate with constipation, heavy metal accumulation. All this is compromised, compromises our detox ability and cause stress in our body. And not to mention, not to forget the fat and protein metabolism there, because when we have digestive disorders, the healing slows down. We are unable to lose weight. We can have ammonia-like odor in our sweat. Just digestive system plays a huge role. So cortisol is an important and primary reason we look at urine test and saliva test, because it's our main stress hormone. It's made in the adrenal gland. It's an anti-inflammatory hormone. It raises blood sugar when it's necessary. It's a painkiller. So people feel better with high levels of cortisol, and adrenal glands can produce the high amount of cortisol as long as they are healthy enough to respond to the stress. But we just need the right amount, not too much and not too little, is how much of cortisol we need. So let us take a look at a new share. Here we go. So this is a chart called progression of HPA axis dysfunction and this cortisol dysregulation. HPA axis being hypothalamus connected to pituitary, pituitary connected to adrenal. They all communicate with each other in regulating cortisol, our stress hormone. So that's what it's talking about. And this chart illustrates that adaptive response to this HPA axis. So what happens to cortisol production in normal phase, and then what happens to cortisol production in the next 3 phases is what we're going to talk about. So let's talk about the normal phase. We don't really see people in this phase because we actually feel pretty good. We're not looking for help. We're not under any chronic stress. We have a normal stress response. If some stress happened to occur to us, our cortisol will respond properly. It will elevate in response to stress. And by evening, the cortisol will actually go down, we get good sleep. We wake up normal in the morning because cortisol should rise when we're under stress. So then where the problem lies is in the acute phase, where, let's just say acute phase is that we are under stress, but we're able to keep up and we are actually feeling pretty good. So we might be burning candles on both ends, but healthy adrenal glands will respond to that stress and pump out that cortisol. So people will feel pretty good, but the problem is that it can mask a lot of symptoms. They push themselves too hard and they don't realize, and we thrive on those to a certain level. So we can multitask, we can go to the gym, we can cook food, we can over-exercise, we can overwork ourselves, but the cortisol is doing its job to compensate for that. And it's doing its job, so we don't really see so much, but we are actually burning candles on both ends. But you know, really what happens in this phase is that there's a lot of things that are happening in the body that's breaking down underneath. And in this acute phase, it's really hard to maintain. How long will they stay in this stage really just depends on their constitution. Some people can take years before they see any effect of it. Now, some people will be less than 6 months before they slide down the slippery slope into the right-hand side of the HPA axis of dysfunction, what we call the compensatory phase. The one in the orange is called the compensatory phase. Now, in this phase, the stressors are remaining the same, like all the outside stressors. The job, family, financial, relationship, or our inside stressors, blood sugar dysregulation, mental, emotional stress, inflammation, pathogens, food sensitivities. Everything remains the same, but our adrenal glands are just too tired to respond. And in this phase, when we slip down the slope, our DHEA, our hormone, which is like a building hormone, will also start to fall. When the cortisol falls, this hormone will fall, and then the person will start to feel not so normal anymore. And the symptoms will start to pop up. Why? Because cortisol and DHEA are no longer in the levels that they were before. They were there before. So as you know, cortisol is an anti-inflammatory hormone. It helps us to feel good. When it's not around in significant level, you see the way you see in the acute phase. Now, all of a sudden, we start to feel, well, achy joints, right? Joint pain, we start to feel fatigue, more cognitive issue, sleep issue, depression, food sensitivities. And this is the moment where a person might go to a doctor to get methotrexate for joint pain, or Ambien for sleep. And they don't understand the process. They just want to make their symptoms to go away. If the stress keeps up and all they do is go find a medication, they have done nothing to address those stressors and what's happening in their body. This is the phase where we also start to self-medicate with sugar, coffee, alcohol, because we're trying to feel good and we don't know what else to do, to be honest. So we just have more coffee and more sugar because it instantly helps us to feel good, gives us more energy. But how long can we go on in this phase? If we don't address anything in this phase, well, a person will really go down to that exhaustive phase right here. And a person will try to micromanage everything here. They'll try to go to bed on time, eat some specific food, taking certain supplements to feel better. The body is just slowing down to conserve the energy. And some may have autoimmune disease by now. They'll have some diagnosed diseases. They'll see low cortisol levels, lots of blood sugar issues, low body temperature, low blood pressure. And all this can be healed from these. It just takes a lot of self-care, a lot of meditations, a lot of energy building, chi building, movement to recover from this exhaustive phase. So why don't doctors recognize these different phases? When they see a normal cortisol level, because as you can see, a cortisol level in the adaptation phase can look a lot like cortisol in your compensatory phase. So how can you tell, how can a doctor tell if the cortisol are normal? How can they tell if you're under a lot of stress? That's because they don't recognize different phases of this cortisol dysregulation because they are trained to find diseases and prescribe medication. What they need is codes for diagnosing and billing. Basically, that's what they do. Okay, so moving aside from this, I really now just want to talk about the DRESS implementation that I earlier talked about. I want to talk about some strategies to help improve and address those healing opportunities, what we call as DRESS for Health Success Program. So DRESS is really a 5-pillar program. It's called diet, rest, exercise, stress reduction, and supplementation. Now, all are equally important in a holistic approach to building health to get your vitality back. All of them are equally important. So the first one I want to talk about is the diet pillar, the diet, which entails eating organic foods, whole foods, clean foods. So what does your diet look like? Do you eat that way now, or did you always eat like this before? Do you eat organic foods? Do you eat whole grain foods? Do you eat gluten-free, sugar-free foods? So these are the things that we really like to focus on for the next 90 to 120 days, is to reduce our alcohol content, sugar content. And because we want to be diligent with our budget and still try to eat clean as much as possible. Now, remember I said blood sugar is a big stressor in our body. So we really would like to use that intelligent allopathy in case there's a sugar craving going on. And we also talked about circadian rhythm for a little bit. We want to encourage you to, I would like to encourage you to either go to Amazon or any shop for that matter, get a glucometer with some strips um, and some with an affordable price. Look at your blood sugar levels in the morning, first thing in the morning, before lunch, before dinner, before bed, just to see where your blood sugar is and make a log of what's going on. And this is really just going to help us to figure out what a proper macronutrient ratio you might require. Looking at your blood sugar spikes at any time you eat is going to help us to fine tune your diet and continue healing with our coaching. Another thing with diet I really like to look at is food sensitivities, whether we do a MRT test, the mediator release test, or a Zoomer test. This become a really important part of healing in our healing journey with identifying healing opportunities. Food sensitivities play an important role in our immune system's reaction to significant stressors. So our goal would be to remove foods that cause stress, which allows us to heal our body, and fine-tuning our diet based on macronutrient ratio and food sensitivity is going to help us in achieving our goals. Okay, so that's that. Our second pillar that I really like to emphasize on and we work towards is rest, because rest is very important to recover and rejuvenate. I mean, really, what time do you go to bed? Did you know that going to sleep by 10 p.m., so that sleep between 10 and 12 p.m., that 2 hours of sleep is really like 4 hours of sleep after midnight. It really helps to set the circadian rhythm. Going to bed when the sun goes down and waking up when the sun comes up. These are all what I call the true healing opportunities, and helps us to reduce stress. So committing to 7 to 8 hours of uninterrupted sleep is very, very important. And what we do 1 hour before our bedtime really determines how well we sleep at night. So what do you do 1 hour before bed? Are you plugged into your electronics? Do you watch TV? Or do you have any routine 1 hour before bed? Do you shut off your do you turn your blue light filters on? Do you shut off any electronics at night? Do you use any meditation app? Listen to any soft music? Do you have dark curtains in your room? Or do you do warm baths? Now, all these things that I asked is because they all help to decompress, and they all help to shut the brain down so we can rest well at night. And if you're not doing that, you'll just have to be patient with yourself and implement new habits. And new habits don't happen overnight, so don't sweat over it. We just take one step at a time. Okay, so our third pillar, exercise, is also very important. There are many wonderful benefits to exercising, as you know. When we think of exercising, we think of muscle tone, bone health, having good range of motion, heart health, because movement in general is so beneficial for our bodies, our blood flow, and our lymphatic flow. But exercise can also be a big stressor on our system. And that's why we want to evaluate what we're doing is right for you. What's supporting you knowing your stress and your hormones? Let me know what you're doing for exercise. Are you doing too much, too little, or just the right amount? Are you doing intense cardio exercise? Are you doing walking, a light exercise, weight training, restorative yoga, swimming? What are you doing? And what does interest you? So we would like to go into detail about that. Okay, and do you sleep well at night? Do you feel good? Do you drink enough water? How good you sleep at night? All this will play an important role in reducing that stress. Okay, so the fourth big pillar that I now like to talk about is the stress reduction. Now, this one is huge because there are internal stressors and external stressors. So let's first talk about external stressors. I have a list of the external stressors being the healthy home checklist if you check in the environmental working group. There are so many different stressors that we can take a look at, from toxic exposures in the environment, like in our foods, the pots and pans we use, the deodorant we use, the soaps we use, any kind of personal care product, hair colors, cleaning supplies, anything you name it. It's all found in the environmental working group. So what we're going to do is make a list of 2 or 3 things that are using and try to work towards changing them. We want to keep that toxic exposure down as much as possible. And I also encourage that you surround with more supportive people that are going to help you support in your mission, in your friends and family and anywhere else for that matter, work. So let's take a deep dive into internal stressors. Now, these are the stressors that I like to do additional testing on to figure out what else may be going on in your body. So we can dig deeper in the gut and see what else is causing the problem. Is it the food sensitivities? Is it the leaky gut? The quality of the gut? Are there any pathogens in the gut? Are there any infections going on that's causing you to have more stress in your digestive system? Any kind of parasites, bacteria, viruses, anything like that. That is going to help us to identify if your hormones are either elevated or really low, and also follow up with some hormone panel going forward. All right, so that we can go more in detail in when we go in that section. So supplements is my 5th biggest pillar that I am really passionate about talking about, because as you know, supplements provide balance in our body. They substitute for a lot of missing element in our body that we're not getting in our food supply. So because our soils are depleted in minerals, we don't really get so much from our food anymore like we used to. So not meeting our micronutrient requirement becomes a huge concern. So some supplements provide us with stimulation for underperforming organs and systems, like thyroid, adrenals, things like that. Some supplements are good for a support system. So when you're no longer making something in the body, it helps to support that. So it fills in the void in your body. So when supplements when we order supplements, I also like to talk about scheduling them as far as sequencing and titration, because it's going to become important to know what's working and what's not working. So titration and sequencing is what we'll be focusing on. So the reason we do this is because we want to control all the variables when it comes to taking supplements and control the amount of dosage that's right for you. So for example, if I give you 10 supplements at a time, and if there's a negative reaction that occurs, we want to know where it's coming from, right? So if you take your supplements one at a time, starting at a low dose and progressively work to increase to max dose, that works just the best for you. We can control those variables and personalize your own protocol. And along with that, we can work with titration, taking one supplement at a time and introduce one at a time. Okay, so that is that. In our next segment, I look forward to talking more on our new topic.